Hey, everybody, this is Dr. Dana Gibbs here. Today, I want to talk about Hashimoto's thyroiditis because I'm getting a lot of questions from people who want to know what is Hashimoto's and what does it have to do with the low thyroid topics that I talk about all the time. So, here we go. If you're listening to this and you're not a physician, please keep in mind scientific proof is not nearly as black and white as people think. And in order to make treatment and decisions for individual people. Sometimes we have to consider evidence that's not nearly as absolute as we would like. This is not meant to be medical advice, and you should consult your own physician for any issues or diagnoses you may have. All right, so what is Hashimoto's disease? Well, it's one name for one of the two major varieties of autoimmune thyroid disease. It's also known as chronic lymphocytic thyroiditis or just autoimmune thyroiditis. And it's actually the most common disorder of the thyroid gland in the United States. And it's also the world's most common autoimmune disorder by far. It affects 15% of all Americans. And for women who have allergies, that is really high. It's up to 24% of women who have allergies. So it does run in families, but about a half of my patients that come in don't know what that have it, don't know of any relatives that have it. It is the most common cause of hypothyroidism or low thyroid function, but it can also cause elevated thyroid hormone levels, which is hyperthyroidism. And people who have it are frequently misdiagnosed with Graves' disease if they have high thyroid levels. Um, Graves' disease is another autoimmune thyroid condition, and we're going to talk about Graves' disease next time. But Hashimoto's can also present at first glance with seemingly normal levels of thyroid hormones. And some doctors or some people call this subclinical hypothyroidism. I actually don't like that name because it implies that the people who have it don't have symptoms, which, as you will see, is not true. What they actually have is normal labs. So maybe we ought to call it sublaboratory hypothyroidism. Um, However, you can find it if you know the right labs to do, but the labs that don't show it are your normal routine T4 and TSH a lot of the time, until it gets really, really end stage. But anyway, so in Hashimoto's thyroiditis, the immune system has, for a variety of reasons, become allergic to your thyroid gland and basically attacks it with antibodies and cells and other parts of your immune system that are generally supposed to attack infections. So the normal immune system, the normal purpose of antibodies is to flag disease-causing foreign agents like bacteria and viruses that need to be destroyed by other cells and components in your immune system. And in an autoimmune disorder, the immune system is producing these rogue antibodies that target your healthy cells or proteins in your body mistakenly, kind of by mistake. In Hashimoto's disease, the immune system is producing an antibody, something called thyroid peroxidase, which is one of the enzymes that helps make thyroid hormone inside your thyroid gland. And it's really only found inside your thyroid gland, but it's an important one of the thyroid proteins. Most people with Hashimoto's disease will have thyroid peroxidase antibodies in their blood. Then the other main antibody that's seen in Hashimoto's is the thyroglobulin antibody. And thyroglobulin is a protein that binds and helps store thyroid hormones. Also, once again, inside your thyroid gland, but then it can also circulate through your bloodstream, carrying the thyroid hormone around in your bloodstream. So these antibodies cause destruction of the adjacent tissues of the gland, not just the proteins that they target. And what happens sometimes is that can release a large amount of thyroid hormone all at once in that process. And if you've listened to my other lives, you probably know that our thyroid hormones set the rate of our metabolism. and that's how your body produces and uses energy. So a person with Hashimoto's can be hyperthyroid for a while, and then euthyroid, which means your thyroid hormones are normal levels, before they finally become, frankly and obviously, hypothyroid. But here's the deal: in about 50% of people who have Hashimoto's disease, the problem goes away after a few months, and it goes away as quietly as it started. This really, really frequently happens, especially in women, of course, after they've had a child. So people will come in and say, doc, my symptoms started right about the time I had my second baby or first baby or whatever. But for some reason, the immune reactivity of the pregnancy time period and then the changes that happen after you're pregnant seem to trigger this to happen. Um, so in half the people, it goes away. Another half will gradually and slowly end up with a damaged thyroid gland that doesn't make as much hormone as it needs, as your body needs anymore. And that's when most doctors will step in to treat you with thyroid hormone. However, there are a lot of symptoms that can come before the gland becomes non functional like that. And those symptoms can include inflammation of the thyroid gland itself. So, people who have um, a swollen and tender thyroid gland, sometimes it's because of autoimmune thyroiditis or Hashimoto's disease, as well as all the symptoms of low thyroid function that we associate with a non functioning thyroid gland, like feeling cold all the time, having memory problems, losing hair, um, abnormal weight gain or inability to lose your post baby weight if it's a post pregnancy. Um, there are so many other symptoms, and I am going to go over symptoms in detail in another live, so I'm going to leave that alone for now. But what's happening there is that your thyroid gland is being infiltrated by white blood cells called lymphocytes, and they replace normal thyroid tissue, and then eventually they cause scar tissue to form. And if your thyroid gland recovers from that, frequently the scar tissue remains. And if parts of it start to grow back, then it'll grow back in a nodular pattern, or even with a frank swelling where it's larger than it was before. And we call that a goiter. Um, those can get quite large and can even be mistaken for thyroid cancer because of the cell types that are in there. Or the antibodies can block the action of TSH, which is the brain chemical that triggers the release of thyroid hormones and production of thyroid hormones. And that can, if it's completely blocked, then that can cause your thyroid gland to basically just shrivel up or atrophy. Additionally, patients with Hashimoto's disease generally don't efficiently activate and process the T4 or storage thyroid hormone to T3, which is the active one, because of those large fluctuations in thyroid hormone that happen because of the antibody attack. People can end up with high levels of what's called reverse T3. And as you may recall, if you've listened to some of my other lives, reverse T3 is an inhibitor of T3. And even if you have enough of it, you may feel like you don't. And you certainly don't get better by taking more of the T4, which actually just makes the reverse T3 go even higher. Anyway, so there's a variety of options for treating Hashimoto's thyroiditis. Firstly, some people believe that you can turn off the autoimmune attack or hasten a remission. And there are some European studies showing that taking selenomethionine, 200 milligrams daily, will stop the thyroid peroxidase antibody production in about 75% of cases. This has not been as successful in studies done in the US. And sometimes I wonder if that's because our eating habits are there's just so much more pro-inflammatory foods eaten here in the US than there is in Europe. but that is complete and utter speculation on my part. Um, there are a few trials that suggest that simply shutting down your thyroid hormone function production, shutting it completely down with prescription hormones may relieve the problem. As I mentioned just a second ago, though, using T4 is generally going to make you feel better, even if it normalizes your blood values of T4 and TSH. So, in theory, when you shut down the thyroid gland or put it on vacation, then it no longer makes that thyroid peroxidase enzyme and it no longer makes the thyroglobulin protein that have riled up the immune system. And after a while, the cells that are making those antibodies will hopefully die out for lack of stimulation, and then presto, a cure. And that actually does seem to work sometimes, but it can take a long time. It can take 2 to 3 years to work. Um, so Yes. Secondly, the symptoms that are caused by Hashimoto's disease can be taken care of by taking thyroid hormone. No, most endocrinologists don't agree with this, but they're all using T4, as I mentioned a second ago. That's levothyroxine. So taking the active form T3 with or without a little bit of T4, depending on the circumstances, can suppress your thyroid to help reduce the size of a large painful goiter or a painful thyroiditis. And if you do it carefully and you don't suppress the gland, you can resolve low thyroid symptoms caused by inefficient activation of T4. And then, while evidence is really slim for this, you can modulate your diet to reduce inflammation. And I do really feel like this has a place in the treatment of Hashimoto's disease as well. I don't have time to go in that today, but basically, a whole food, high fiber diet that eliminates exposure to pro inflammatory food ingredients like processed vegetable oils can really be a valuable adjunct to hormone modulation to help improve Hashimoto's disease. All right. So, because Hashimoto's has so many faces, there are really lots of different items on our treatment menu. So, if you have Hashimoto's, I encourage you to explore options that may help you in some detail. And all right, so that's really it for now. I'm Dana Gibbs, MD. I'm an integrative physician here in North Texas, and I help people address their thyroid and other hormone imbalances if they haven't gotten relief from more traditional ways of doing things. So my website is www.danagibbsmd.com. And I have a newsletter that you can sign up for there to get valuable tips and notifications each time I do another one of these lives. Or if you're a thyroid or a chronic fatigue sufferer in North Texas and you need a caring doctor to help you finally resolve your exhaustion, your joint and muscle aches, your poor sleep issues, and your weight gain, come now and sign up for a new appointment with me now at www.danagibbsmd.com. Thanks for listening, and I'll see you guys next week. All right.